Now let's talk about seizures. Seizures are the most common pediatric neurological disorder, and the symptoms of seizures are due to abnormal electrical activity in the brain. There are many potential etiologies of acute seizures, such as febrile episodes, which cause febrile seizures, intracranial infection or meningitis, traumatic brain injury or hemorrhages, space-occupying lesions like a tumor, cerebral edema, or ingestions. Also, metabolic imbalances can cause seizures, such as severe electrolyte imbalances. Some of these metabolic alterations are listed here. Etiologies of chronic seizure disorders are a little bit different. Often the child has a family history of seizures. There's idiopathic epilepsy, but also secondary epilepsy, which may occur after the initial trauma, hemorrhage, infection, or ingestion. Regardless of the etiology, the pathophysiology of seizures is basically the same. There is a sudden and excessive excitation of the neurons in one area of the brain, which then fire, causing the symptoms. Types of seizures can range from simple partial seizures, which include perhaps subtle motor or sensory deficits, to generalized tonic-clonic seizures, which typically involve the entire body. However, there are also more rare types of seizures, such as absent seizures or staring spells, atonic seizures, where the patient loses all skeletal muscle tone, and myoclonic seizures, which are characterized by jerking moments. An important term to remember is status epilepticus, which is defined as either a continuous seizure that lasts more than 30 minutes, or a series of seizures in which the child does not return to their baseline consciousness between. This is a medical emergency, as it can lead to brain injury, exhaustion, respiratory failure, and death. The period during seizures is called an ictal state. It is followed immediately by a post-ictal state, in which the child may be drowsy, uncoordinated, aphasic, or confused. The most important thing when we're taking care of a patient with seizures is not only to treat the seizure to prevent brain injury, but also to find out what's causing the seizures. In order to do that, we typically perform a detailed history, including a family history, a comprehensive physical and neurologic examination. And again, these neuro examinations will be serial in nature. We'll also get lab work and consider neuroimaging. Almost all children with seizures will have an EEG performed. An example of children who do not need an EEG are those with simple febrile seizures. The EEG is the most useful tool for evaluating seizures because we can tell, based on the results, the area of the brain that is affected. The goal when treating seizures is to not only control the seizures or reduce their frequency and severity, but also to discover and correct the cause if possible. We want to help this child live as normal life as we can. Most children with repeated seizures will require anticonvulsant therapy, and this is just seizure medications. Examples include Keppra, Onfi, or phenobarbital. Other less common management techniques include a ketogenic diet, a vagus nerve stimulator, or even surgical therapy, where the neurosurgeon can go in and interrupt the pathways responsible for the seizure activity. The nursing care of a pediatric patient with seizures includes ensuring their safety. You also want to observe the seizure episode and note the onset and any behaviors and movements the patient had during as well as after the seizure concludes. You also want to note the timing. Keep in mind that many PRN medications such as lorazepam or Ativan are written for seizures lasting over a specified amount of time. Again, you want to ensure patient safety. This means that you're not going to attempt to suction the child or place a tongue blade in their mouth. Febrile seizures are a little bit different. For simple febrile seizures, we only treat the fever with either an antipyretic, like Tylenol or Motrin, as well as any source of infection, such as an ear infection, which may require antibiotics. For the patient with simple febrile seizures, they often don't need to be admitted. They don't require neuroimaging, and they do not require long-term anti-epileptic or seizure medication therapy.